Each year, millions of Americans visit their doctor for a prescription to treat AFib. For years now, the most commonly used anticoagulant has been difficult for many to swallow. Now a new line of drugs are proving simpler to use than Coumadin or Warfarin.
Their advantage is a reduction in the likelihood of interaction with other medications, a reduction in the likelihood of interaction with certain foods or beverages that can be problematic with Warfarin or Coumadin, and importantly, the lack of need for regular blood tests to monitor the control of the anticoagulant.
Studies find that overall, next-gen drugs, including the brand name Xarelto and Pradaxa, were slightly more effective.
The data thus far with the newer agents compared with Coumadin has generally shown a reduction in risk of stroke, a reduction in risk of death, a reduction of risk of bleeding into the brain.
These new drugs are considered more patient-friendly, but there are still a few things to consider. They are more expensive, may increase the risk of stomach bleeding, and at this point there are few options to reverse their effects if needed.
Their half-life in the bloodstream is only about 24 hours, so they could wear off fairly rapidly in the event of bleeding.
In the coming years, more people are expected to need treatment, and drug manufacturers are keeping pace.
There's a lot of new developments in this area that are very promising.
For Lee Memorial Health System, I'm Amy Osher.